Financial and Legal as a sponsor of this programming tonight. I am Linda K. Tyler as the Business Development Director. We're glad to have you join us this evening as we have an informative and interactive presentation planned for you. During the presentation, we do encourage you to submit questions throughout the presentation via the Q&A feature below. If there's a chat feature, we want you to use the Q&A feature. And then Jillian will respond to your questions throughout the evening. I would like to welcome our presenter from Panacea, Jillian Vestal. Jillian is a licensed attorney with a specialized focus in physician contracting. She holds an undergraduate degree in public relations from Harding University and earned her JD from the University of Arkansas at Little Rock. Jillian's professional journey includes significant roles in public and health sectors. She served in the office of former Arkansas Governor Mike Beebe and worked for the State Department of Health. Her career then pivoted towards government relations for healthcare clients and subsequently as a staff attorney for a health system where she was deeply involved in compliance matters, fair market analysis, and contract review, among other responsibilities. Jillian now serves as the head of Panacea Legal. Please join me in welcoming Jillian.
Thank you so much. I am thrilled to be here with all of you tonight to talk about kind of what is likely the next step in this process for you when you are getting into the job market and getting contracts. So we're going to talk through what we do once you're receiving those. So as was mentioned earlier, you can type any questions that you have in the Q&A box. I will do my very best to get to those as they come in. So that way we're not having to wait until the end. If you've got a question in the moment that you don't want to forget, you can go ahead and submit that. This is information that you've already seen, but we're going to talk today again about contracts. We're going to talk about how you navigate the contract, what to do with it, how to understand the risk factors and any potential red flags that you're going to see. That's something that I hear so often. Probably the most common question I get is, what are the red flags here? So we're going to talk about that. We are also going to talk about how having an attorney can help you through this and how you can negotiate these potential terms. So we start with the basic components of a contract, the things that you are going to see as you're getting that first contract, as you are just looking at the document and trying to make heads or tails of what's there, and again, how to navigate what you are seeing. So we've already gotten a couple of questions that have come up. This session will be recorded, I believe. And the other question that I'm getting is it a must to have a dental-focused attorney review your contract with you? I would say that it is really important to have someone who understands your position, who not only understands employment law and employment contracts, but also the specifics of your profession. And we're going to talk through that more as we are kind of going through our presentation tonight. And I think you'll see that having someone who can speak to not just the legal components, but also the market components really is going to be beneficial for you. So again, as you're getting that first contract and you're taking a look at it, there are some broad sections that you're going to see and that we, of course, want to pay attention to. So the first section that we'll likely come across is around term and termination. So this is truly a matter of timing. When does the contract start? How long does the contract last? Does it automatically renew? Can you terminate during the life of that contract? If you are looking at a partnership track position? Does it outline the process for that? Does this contract end when you become a partner and you get another one? Or do we just add an addendum and stick with the same agreement? All of those things you really want to see addressed. You want to make sure that the contract outlines what the timing is. And then we also want to be sure that we understand your duties. That can feel almost a little bit silly because you think, well, of course I know what I'm doing. This is the job that I interviewed for, that I applied for. But we really want that to be captured in the contract. What's your schedule? What's the location? Who determines those things? If the contract says your specific location, can that be changed? Can that be changed unilaterally by the employer, or do you have to agree to that? Those are all things that you want to understand, and ideally, we want the contract to reflect. We also want to understand any admin roles, any supervision of other staff members. If we are taking call within the practice, we want to know what your responsibilities there are. Of course, the contract needs to address compensation. We want to understand how you're going to be paid, what you're going to be paid. We want to know if there are any incentives, if there are any bonus opportunities, and what you have to do to achieve those things. It's very important that this part of the contract is outlined very specifically. You don't want to get into a situation where the contract says, hey, for 6 months, we'll pay you X, and then we'll determine your compensation. Or, then your compensation is subject to any number of things, right? We want to see that outlined. Even if the number is not specific, even if they're not telling you, hey, this is what your take home is going to be, if they're laying out the formula for that, right? If we're looking at a situation where, hey, when your collections get to this particular metric, then this is what your percentage is going to be. That's okay, but we just want to have a good understanding. And of course, we're going to dive into compensation in a lot more detail in just a bit. We also want to understand benefits. Are benefits offered? If they are, when do they start? Sometimes we see contracts that say they'll start the day you start. Other times it's going to be, 60 days from the day you start and then the first of the month after that, or, some sort of convoluted timeline. We want to be sure that we know. Are they offering any CE kind of credit or compensation? Are you getting any paid time off? We want to be sure we have a really clear picture of those things. Connected to that is understanding liability. Contracts come with risk. Every single contract comes with risks. But we want to make sure that those are balanced. We want to make sure that we know who's taking on what liabilities. And ideally, we're going to share some of those. Malpractice insurance, understanding who will pay for malpractice insurance is really important. If you are looking at an employed position, I really, really prefer for the employer to pay for that. I think that that's something that should be offered. It typically is, but it's not a guarantee. Similarly, we want to understand who's responsible for the cost of tail coverage. Tail coverage can be a significant cost. For those who may not be familiar with the term, it is the malpractice insurance that lasts after you leave the job until the statute of limitations has expired. So a patient's going to have a certain amount of time that he or she can still bring a lawsuit. So that tail coverage is going to sort of fill in the gap. Again, ideally, we would see a situation where your employer is going to pay the cost of that. That is still something we see, but less common, of course, than them paying for malpractice insurance. Your contract may say something like, we'll pay for a portion of your tail coverage, or we're going to look at why the contract ended to determine who pays. Again, any number of things is okay, and any number of things may sort of factor into that larger balance that we're talking about, but we just want to be sure the contract tells us that. We also want to look at financial penalties that may be associated with termination. If you're getting a signing bonus, if you're getting some relocation money, if you leave during a certain time frame, do you have to pay any of those back? Sometimes I've seen contracts that say if you leave within a certain time frame, you're going to repay any of their costs associated with bringing you on. So that may be credentialing, it may be onboarding, all of those things, again, should be outlined in the contract. And then another section that, again, is closely associated with risk here, and with the exit strategy is restrictive covenants. So just as the name implies, this is a restriction or a limitation on certain activities. You are kind of making a promise that you won't do these things after your contract, after you've signed your contract. So exclusivity is something that we see really frequently in employment contracts, and it's going to apply while you're working there. So it's going to sound something like, while you're employed, you won't provide services for another employer. It may say you won't do it at all. It may say you won't do it without without permission. It may say that, hey, you can do this, but you have to tell us. Any of these things, again, may be okay for you, but you just want to understand what those expectations are. We also want to understand post-termination restrictions. So a non-solicitation is, again, sort of just like it sounds, it's saying that you won't solicit patients, employees, you're not going to sort of go after people who have a relationship with the practice where you're working. Again, it's all a balancing act in contracts. So often a non-solicitation is going to be fairly reasonable, right? Hey, you can't solicit directly to our patients to tell them that you're moving across town. Other times it may be overly restrictive, right? You can't see this patient. You can't treat this patient for 2 years. Well, that's really limiting that patient's right, that patient's ability to choose his or her own provider. So that's where it becomes problematic. Anytime we're talking about a post-termination provision, I always want to understand the situation that the individual is in. So if you're telling me, hey, I have this non-solicitation in my contract, but after a couple of years, I plan to move to another state. This is not really where I'm from. I'm going here because of my significant other's job. Not a huge concern. Then the non-solicitation is not going to be something that I'm overly concerned with. The same with the non-compete. The non-compete certainly is the one in this category that gets sort of the most attention. And that is a restriction that's going to have two components. It will have a time component and a geographic component. So it may sound something like, for 1 year after your contract ends, you won't work within 10 miles of a particular location. Again, it's all a matter of degrees. It's all a matter of sort of what your circumstances are and what you're looking to do. If you tell me, hey, I'm going to my hometown, this is the only place I've ever wanted to practice, I never want to live anywhere else, then we're going to really pay attention to that non-compete. We also want to pay attention to the location from which you are limited. So let's say that you're joining a practice that has 10 offices, and you will only ever be in one. I don't want the non-compete to apply from all 10, right? We want to be sure we can limit it to that one. I also want to address here the fact that I get a lot of questions about the enforceability of non-competes, if they're allowed, if they're not allowed. So we are seeing some states move toward not allowing them. There are a handful of states that say, no, you can't. We see some states that restrict them for healthcare providers. We see some that restrict the length, right? You can't have one more than a year. Or Colorado, I believe, says, hey, you can have one, but you have to give them a way to pay their way out of it, right? So yes, you can have a non-compete, but there has to be kind of a financial way out. At the federal level, we saw a little more than a year ago, there was a new rule by the Federal Trade Commission that essentially said, hey, we're going to do away with non-competes. It was immediately challenged. It kind of worked its way through the federal district court in two different courts, and those two judges answered the question differently, which sort of leaves us in this really weird situation where we don't know the impact of it. If it is continued, if pursuit is continued, then I think it will almost certainly end up at the Supreme Court. The sort of further complication is that we've had a federal administration change, and we don't really know if this administration is going to continue to pursue that or not. So I say all that to say it's really state specific. Do not assume at the federal level that it's not going to be applicable. Again, this is something that I think is, really worth talking with an attorney about. I'm seeing here a question about whether or not attending a residency program falls within the restrictive covenant. Typically, further training does not. So it's going to say something like you can't practice, you can't be employed by, a healthcare entity, something along those lines. But it typically does not say, it does not limit any educational pursuits. Again, I would want to see the specific language of the non-compete, but I have never seen a situation where a training program is limited. Okay, so these are, again, sort of the sections that we see, the broad categories that we see within a contract. Now we're going to talk about, okay, where are there some problem areas? Which of these do we really need to pay particular attention to? To no one's surprise, compensation is certainly a big one. Understanding how you're going to be paid, understanding any options for additional compensation is going to be huge, and we're going to spend some time there. We're also going to talk about risk. We're going to talk about understanding your exit strategy. And I know that that can seem really odd to talk about when we're starting, but I would tell you it's the best time to talk about exit strategy. And then we're, of course, going to talk about the duties, what is required of you, what job you are signing up for. So we're going to start with how to assess our compensation. We have our friend here, Dr. Jones. He signed a contract. It says he gets $250,000 a year. He's really happy. And then he gets his first paycheck after that first year, and it's quite a bit lower. He maybe remembers something about a bonus, but he, just has no idea what has happened. So what's the problem? What did he do wrong? Clearly, he did not understand the compensation as per his contract. He may have relied on what he heard, what he was told. He didn't understand the structure. And he also likely didn't understand the questions that he should have asked about compensation. All of these things, of course, we're going to talk through. So when we're looking at clinical compensation, there are going to be four kind of broad categories that I see that outline kind of how you're going to be paid. There can be a lot of variation within these models, but these are kind of the big categories. The first is a guarantee. It's going to be a flat annual salary, not dependent upon any particular metrics, not dependent upon any achievement, but just this is what you're going to be paid for this length of time. We often see a situation where this is going to be available to you for a short period of time. So maybe a year, maybe 6 months. You're going to have a guarantee, and then you may transition to a different option. I see your question here, and we're going to get there at the end of this. Another option that I see a lot is a guarantee plus production. That's where you're going to have a flat annual salary, but you've got the ability to make more than that. Again, with dental contracts, this often looks like a daily rate that you're guaranteed. But if your productivity exceeds that rate based on the formula, then you'll get that higher amount. The productivity bonus is typically going to be based on collections and dental contracts. So often it's going to be, we're going to look at your collections. We may subtract what you've already been paid, so that daily rate, and we may also subtract some expenses, maybe some lab fees, and then you're going to get a percentage of whatever's left over. It's also possible to see a situation where instead of kind of delineating each and every one of those costs, you're going to see a situation where it just says, whenever your collections get to 1.5 times your guaranteed rate or 2 times your guaranteed rate. So they're just sort of building in some of those expenses. You really want to pay attention to the percentage here to kind of what you're getting of the overage. I really, really love when we can get close to 35%, or as close. I love as close as we can get to that, if not on that. I see a lot of contracts starting in that 30-32% range. You may also see a tiered structure. Again, where we're going to have a guarantee, a daily rate, but then once we exceed that, you're going to get a certain amount of, or a certain percentage of your collections. The next option we see is productivity only, historically called an eat what you kill model. This is going to be with independent practices, private practices. If you are 1099, you may go straight into this model without kind of going through a guarantee or a guarantee plus production. Again, you want to understand the formula really well. You want to make sure that you know what expenses you're responsible for. In some ways, this is the most straightforward, but it is also certainly the riskiest. I'll say that it comes with the most risk, but you want to understand what that looks like. And then the fourth option that I see from time to time is just a time-based model where you're essentially paid a shift rate, an hourly rate, a day rate, and that is what it is. Now, when we're looking at that, which is much, much more rare in dental contracts, but we would want that, let's say, daily rate to be much higher than what we would see in kind of that, lower guaranteed rate where you have the option for productivity. So a couple of questions that I'm getting. The first being, what is a 1099 position? So 1099 is an independent contractor. A W-2 position would be an employee. So as a 1099 or as an independent contractor, you're typically not going to have benefits. You're going to be responsible for a lot more of the costs. They will not withhold taxes from what they're paying you, so you'll be responsible for doing that on the back end. And then you're also going to see, you're typically going to have a little bit more control than a typical employee would have. There isn't really a right or a wrong or a good or bad. There can be tax advantages or ways for that to be advantageous to be an independent contractor. But you, again, just want to be sure you understand which you are. The next question I see is it legal if the agreement talks about paying back the remediation cost for every procedure done, even when the dentist has left the practice? So I'm not entirely sure that I understand if they're saying remediation for every procedure that particular dentist has done or just within the practice. I would say this definitely falls in the category of understanding your exit strategy more, maybe even than your compensation. You want to know what risks you have, particularly as we look toward the end of your contract. And we certainly want those risks to end as much as possible when your contract ends. So again, in terms of, is this legal? Is this not legal? I would have to understand more about the particular contract, but it is certainly something that I would say you want to be sure you understand well. I have a question that says, should a daily rate be for at least 3 months or 6 months? So whenever we're seeing a contract that has a guarantee or a guarantee plus production and we have a daily rate, in terms of how long do I want that daily rate to last? As long as it possibly can. 6 months is great. I think 3 months is pretty quick. Um, to sort of assume that you're going to be up and running by that point. Now, if they're willing to give you three and that's all they'll do, I mean, I would certainly still take three. But 6 months or even if we could get a little bit more, that would be great. So you also, though, want to be sure that you understand whether or not you have the ability to make more. So are we looking at a guarantee or are we looking at a guarantee plus production? If it is only a guarantee, then and it's a relatively low rate, you may want it to only be 3 months. If you still have the ability while it's guaranteed to earn more than that, if you're hitting certain metrics, then there's not really any risk there. And I would say the 6 months is probably the best option. Um, does the 35% I mentioned regard collection, production, or adjusted production? Also, is negotiating about working on production something that some employers will consider? So with the 35%, that is for what I would call, which is not really an option here, adjusted collections. So you're typically going to see that it's going to be your collections minus certain expenses. So, maybe the share or the cost of your health insurance and other things like that, plus possibly a share of other expenses, things like that. I don't typically see those awarded based on production. So it's not about what you're producing, it's about the amount that is collected based on what you're producing. So that's what I was talking about with the 35%. And then the second question is negotiating about working on production, something that employers will consider. It depends on what they do. If they have a way of doing things, so again, if they're paying based on collections, I think you're going to have a more difficult time um, getting them to sort of change gears and come up with an entire new way of doing that. And I may not be understanding this question totally, but if we're talking about, hey, you offered 33% and I want 34%, absolutely, that's something you can negotiate. If you're saying, hey, you pay everybody else based on collections and I want you to pay me based on an hourly rate, right? Something that's just brand new. I think that's going to be less likely, maybe a little bit trickier to negotiate. The next question is it better for a dentist to be paid on collections or productions? Again, I would say productions is great. I typically see collections. You certainly, the risk with that is you want to understand what their collection rate is. So you want to understand for every $100 that you bill, how much are they typically bringing in for that? Because at some point that's kind of out of your hands, right? You're not sending out the bills, you're not negotiating with payers. So that would certainly be the risk that's associated with a collections-based model, but it is the thing that I see almost always. And then a final question, or that I have right now, is can you set up an escrow style account to manage taxes under a 1099 contract? So I took one federal income law tax class, federal income tax law class in law school, and I am not going to pretend to be an expert here. I believe the answer is yes. I would definitely say you want to talk to a good accountant about that who can help you. If you are looking at a 1099 contract and that's what you're being offered, again, there are ways to sort of maximize those advantages, and a good accountant would definitely be able to help with that. What is a good collection percentage range? I think, um, to me, it has to be above 30. If we can get to 35, fantastic. Well, 30, 35 is kind of where I like to be. And man, if we can get to 40% or anywhere near there, I am very happy. So that is kind of the range that I would look for in an associate contract. If a DSO is frantically pleading to join them but does not have great benefits and are looking to build their new practice at the expense of the new associate, is this a red flag? Potentially. If I mean, I would just have to know more. Anytime I think the word frantic is there, and at the expense of the new employee, or the new associate, I think that probably tells you what you need to know. Um, Now, if it is a really great, hey, this is an amazing opportunity, you're getting in on the ground floor, maybe there are other considerations there to make, but I would certainly say, and we'll touch on this later. If you're ever getting a contract and they are rushing you to it, like, hey, here it is, just go ahead and sign it, that is a red flag for me. How should we weigh a contract offer that includes guarantee pay plus production, but is from an office that's quite outdated, still using handwritten notes and limited? Um, so I think you kind of have to dig into that practice. You have to understand um, what types of collections we're looking at. I mean, there are outliers and there are situations, and you hear about, the doctor who's been practicing for a million years and is still, like you said, handwritten notes, and is absolutely raking it in, right? Their collections are extremely high. So I can't say, um, oh my gosh, run away. But you do want to understand any risks there. And I think you also want to understand how that might affect you, right? If you're somebody who can just sort of take the answer of this is how we've always done it, or if that's going to be just kind of a constant pain point for you. Um, a lot of what we consider in contracts are the legal implications, but you also want to be sure you kind of think through the personal implications. So, I would say you really want to dig in. Um, Again, if they're doing a guarantee pay plus production, that's, that could certainly be beneficial. But if you're going to if it's going to drive you crazy, then I would that's sort of what I would weigh. I'm the only managing dentist in a practice partnered with a dental partnership organization. Would collections or productions be more advantageous? Probably productions is more advantageous. Again, assuming, and it would depend exactly how we were defining those terms, but assuming that productions is calculating what you've done, not necessarily what's come in, then I think, productions is almost always more advantageous, but collections is almost always what I see. Um, so again, these are kind of the structures you want to look for, you want to be mindful of, you want to understand, and we've kind of hinted at this. Your contract may change over the life. So you may start out in one, transition to another. You may work at one location under one, and then they say, hey, if you want to pick up, emergency clinic shifts, that's going to be paid hourly, right? Or something like that. So there can be different models within one contract. So don't assume anything. So we also want to understand additional components of compensation. So are you going to be supervising? Do you get a portion of product sales or injections? Are you paying a portion for labs? Are you taking on any administrative supervision roles? You also want to understand the geography of where you're going. What is the need for a dentist in that area? What is the type of practice? What's the size of the practice? All of these things make a difference. So when we are assessing the compensation, we want to understand how long have they been looking? The question that I had earlier, they are frantic. While I did say that was a red flag, and I stand by that, you may have a little bit more negotiating room if they are frantic, right? If they have been looking for someone for months and months and months, then that certainly changes your ability to come in and make some asks. So we want to understand our compensation. We want to understand how we've been paid. We want to understand the additional components. So outside of the clinical work, what else are we going to be paid for, as we just discussed? The question that I then get all the time is, should I ask for more, right? They said 33%, should I ask for 34? They said 1,200 a day, should I ask for 1,400 a day, right? These are the questions. I think that there are questions before we get there, right? There are questions that we want to consider. So how often are we looking at this compensation structure? Am I being paid based on a 10-year-old model? If so, maybe instead of saying, hey, I want more, let's say, hey, I want to update, right? I want this to be reassessed. Is everyone within the group being paid the same or based on the same structure? That is not saying, does everyone make the same amount of money at the end of the day, at the end of the year? But is everybody's percentage the same? Is everybody's lab fee the same? We want to make sure that we're on an even playing field. Now, that may also mean that it's not the same because after 3 years, you transition to X and that percentage is different or something. That's okay. Again, as long as it is a fair structure that is applied equally. But again, that's a question that I would ask before I asked if they'd pay you more. Are bonuses paid monthly, quarterly, or annually? You don't want a situation where the bonus is going to be paid annually, and you've got to be there at the end of the year, or you're going to forfeit everything you've done before then. Maybe they won't negotiate that, but then let's just know that going into it. If there are circumstances that it's a 2-year contract, but I'm probably only going to be here 1 3/4 year, then let's see if we can make an adjustment there. Are any additional recruitment incentives available? Are they willing to offer a signing bonus? Are they willing to offer relocation? Are they willing to offer a retention bonus? After a couple of years, will they incentivize you to stay? These are things that we see. So you want to be sure that you're maximizing those. I received a question that asked, if you get a signing bonus, is it an issue if you leave after a year and move to another place? That's really going to be based on the contract, and that's going to be language that we want to see. So often, if you get those incentives, there is going to be a time frame that you're expected to stay. I've seen anywhere from 1 year to 5 years. The longer the time span, typically more money you're going to receive. Not always the case, but typically that is what we see. I would say, a year is probably the minimum if you're going to receive that. I would want to look at the terms there. So if you're going to have to repay, I would want that to be prorated, meaning if it's a 1-year commitment, then for every month you're there, let's forgive some portion of that, right? Instead of just saying it's an all or nothing. So I can't say for sure without seeing that particular contract, but often, yes, there is going to be an expectation that you're going to stick around for some period of time. Is it challenging to get recruitment incentives from private practices, or is this more common? In my opinion, it really depends on the size of the practice. When we're talking about a really small group, those can be a little bit trickier because that means that everybody's got to sort of ante up, right? And pay something toward that. If it's a larger group that can absorb that cost a little bit more, um, then, that's going to be um, more likely in that particular circumstance. Um, I got a question here about termination notice, and I'm not going to answer that right now because we are going to address that very point momentarily. So, another question to ask is when will I be eligible for increased compensation? Um, does the rate change after a year, after 2 years? If we're looking at a collections based or production based, um, if your collections hit a certain threshold, do you get an increase at that point? Any of those things are options. And again, that may be the place to ask for more instead of just coming in and saying, hey, I want a higher rate. If you take on more responsibility, will you receive more compensation? If you become the managing partner at a particular location, if you are supervising non-dentist staff members, do you get any additional compensation? You want to be sure that as you're doing more work, you're seeing that payoff somewhere. Is my compensation guaranteed? How long is it guaranteed? The question earlier about is a 3 month or a 6 month better? And we talked about there are some different factors to consider, but maybe that's actually the best ask. The best ask for your contract is not for a higher rate, it's for that rate to be guaranteed longer. Um, Again, just a really good thing to understand. And it's also important, I would say if we're going to be production only after 3 months, then my question would be, what are the typical collections that you see in a new associate after 3 months? So that way we can start to plug in some numbers to their formula and understand what you should anticipate. So that's kind of our conversation about compensation. We're going to talk about risks and about exit strategy next. If you have any additional questions about compensation, certainly feel free to keep coming with those, and I will do my best to get those answered. So we have Dr. Singh here. She became employed at the practice where she trained. Um, she's, happy. Things are going well. Now it's been a couple of years. She's got a new offer. She wants to move on, but she doesn't really know um, what she needs to do. So the problem here is that she didn't really understand her exit strategy before she started. And again, I know that that can feel really awkward, but in my experience, it is the very best time to determine your exit strategy. You don't want to rely on what you've been told, and you want to be aware of any penalties. So there are two types of terminations. A for-cause termination is not nearly as common. It means someone has specifically not fulfilled their obligations. We don't see this utilized too often. And I would say if you find yourself on either side of this, either they're alleging that you've done something for cause that would necessitate a for cause termination, or if the employer has, I would definitely consider talking with an attorney. But again, not something we see a lot. What I see more often is a without cause termination. Nobody has necessarily done anything wrong. Someone's just choosing to end. 90 days is the typical notice period. To answer the question that I got earlier, if the employee has to give 60 days or 90 days and the employer is only going to give 2 weeks or 30 days, that's a concern for me. I want everybody to have the same notice period. I want those rights and the timeframes to be mutual. Again, 90 is the most typical. I'm okay with 60. I'm okay with 120. I don't really like to get too far kind of outside the bounds of those numbers. We also want to make sure we understand additional risk factors around termination. So, as we talked about previously, understanding malpractice insurance and tail coverage, knowing who's going to pay for that. Um, we would love to see your employer pay for tail coverage. If they won't, then we again want that to be really clear. And it may be that you can ask for the new employer, the place that you're leaving to go to, for a signing bonus that would cover tail coverage or something like that. Those are things that we definitely want to see. Again, you want to understand the non-compete. We want to understand how long it lasts. We want to understand the state law, where you're going to be practicing, to know, um, whether or not that is going to be applicable. You also want to understand financial penalties. As we talked about earlier, are you going to be repaying any signing bonus, any incentives? We want to understand how long your compensation will last. And I got a question about this. They're saying they won't pay, the employer has said that they won't pay after notice is given. That is certainly a concern. Again, I would want to see what the contract said. Whenever we are looking at a collections or production-based component, I suggest asking for a couple of things. Number one, of course, you want to be paid through the notice period uh, without question. I also encourage you to ask for a final reconciliation 60 to 90 days after termination. Whenever you are seeing a patient and you provide a service, you typically don't collect that money the day of the service. So let's say it's a month before your last day, you're providing a service. It may be 45 days after that before all of that money is realized. 45 days after that, you're already going to be gone. So if you're being paid based on collections, unless we get a final reconciliation, you're going to be forfeiting a month to 2 months compensation at that point. So not only do we want to be paid through the notice period, we want to be paid beyond that. We want there to be a reconciliation after you leave. So we want to look for provisions that say things like your right to compensation will end as of the date of termination. We would like it, to extend beyond that. That's a great question, though. So also seeing a question here about compensation and how that changes within different states. So it does change a bit within different states. I would say the structure doesn't necessarily. So as I said, when we're talking about percentages, those typically stay relatively similar. I've reviewed several dental contracts lately across the country, and we were looking at pretty similar collection percentages. Now, the daily rates is where we're going to see a difference. Typically, in my experience, the question continued, should we try to find local legal team to review the contract? In my experience, it may be tricky to find a local legal team that understands dental contracts specifically. If you can and you know of somebody, then certainly that would be great. But usually, like I said, if you're looking at kind of a local just employment law or contract law, they may not have that understanding. So again, we do see some variation in terms of maybe the total collections, but the percentages and those clauses are going to be pretty standard. And so I think having somebody with experience and expertise in the field, in your field, is going to be important. An employer initially brought up average production numbers, but we're seeing that the compensation is much less. This is a tricky one because the conversations that are had are not always necessarily in the contract. So if they told you, oh yeah, your production's going to be X, but the contract really didn't have any guarantees there's not going to be a lot of ramifications or, a lot of repercussions for them. Now, I think it's certainly worth having a conversation. to, understand, hey, we talked about X, I'm now at Y. Um, Obviously, seeing some differences here. What can we do to get there? I mean, I think um, it's certainly worthwhile to have that conversation. Again, unless there was some contractual promise, it's going to be hard to sort of, you know, point back to that. Is it a red flag if a contract requires a long-term commitment, like 3 years? I see 1 to 3 years very often. Um, I don't think that's inherently a red flag, but I do think you want to make sure you can get out of the contract. So if we're seeing a situation where it's a 3-year contract and you have no option to terminate, then yes, I would say that's probably a red flag. A 3-year contract term, just on its own, I don't think is a concern. Um, so the last section we're going to talk through is understanding the expectations. Talking about the duties of the job. What should you expect? What they expect from you. So Dr. Wen recently joined a group of 4 other dentists. They all have Fridays off. She thinks this is going to be fantastic. She gets there and she sees on the first week that she's scheduled for Friday, but she's got Wednesday off. Obviously, she is not pleased with this. So the problem here is that she made some assumptions. She relied on what she saw, what she heard, and she didn't ask for specific details. So there are things that you want to understand about their expectations, and a lot of these we ideally would like to see in the contract. So understanding the time requirement. Are you expected to do a certain number of hours, a certain number of shifts, a certain number of sessions? Is it a 4-day work week? Are there weekend shifts? Do you get to pick the days if it's a 4-day work week? All of those things are important to know. The same with location. Is your location specified? Can they send you to additional locations? I love when language around the schedule and around your location say that those things will be based on mutual agreement. Meaning, if you're going to work in the Chicago area and this practice has 15 clinic locations, they can't send you to the other side of that metro area unless you say, yeah, that works for me. I'd like to go. If they want you to start working every Saturday, you're not going to have to do that unless that also works for you. We want to understand call volume. Understand if this is something that you're expected to do. Understand if there are maximums. Understand how that's split up. And then also understand volumes. Are they in a situation where they're growing faster than they can keep up with it, and there is a huge need and a huge wait time for new patients, and they desperately need someone? Or maybe it's a situation where you're taking over for a retiring dentist, and there is a patient panel kind of at the ready. Or maybe it's a situation where they're trying to break into a new area and you're really going to have to do some practice building. There's not a right or wrong there, but you want to know what to expect. I don't anticipate that volume and questions around volume will be specifically addressed in the contract, but I think that they're really important factors to understand. These are other great questions to ask about expectations. I, again, don't expect that all of this will be in the contract, but there are just things that you want to be sure, that you understand kind of their answers and have these conversations. So our last little section here is about red flags. I think that my answer here is always disappointing because I think people want me to have a magic word or a magic phrase that, hey, when you see this, run away. Unfortunately, that's just not the case. It's much more, again, it's much more about that balancing act that we talked about previously. A lack of transparency is the biggest red flag. If you're asking questions and just being stonewalled and not getting anywhere with those conversations, that's a concern. If all of the details are at the discretion of the employer and they're not forthright, not forthcoming, and the contract just says, hey, trust us, we got it. I'm concerned with that. It's also a concern when you're taking on all of the risk, right? You've got to give 180 days notice. You've got a 3-year non-compete. You're paying for malpractice insurance. You're paying for tail coverage. And oh, by the way, we're going to tell you where we want you to work. Don't worry about it, right? Whenever we see an imbalance like that, that's really where the red flag is. And as was mentioned earlier, when they're pressing you to sign the contract, when they are wanting to rush the process along, again, not being transparent, that's certainly something that we want to avoid um, if possible. Um, so we've talked about compensation structure. We've talked about exit strategy and the risks associated. We've talked about your duties and the expectations for your job. Those are, again, things that I think are really important to understand as you are entering into this season where you will likely be seeing a number of contracts. So my email address is here along with the website for Panacea Legal. I don't know exactly what our time is like, but I am more than happy to take some additional questions. But if you'd rather reach out and have that kind of direct conversation, please feel free to do that. I see a question here about liquidated damages worth 3 months' pay if breach of the contract occurs. Is that legal? Um, Again, those kind of questions are difficult to answer without kind of seeing the full context. I would say liquidated damages provisions generally are allowable. I can't say, again, for sure in that circumstance, but um, my gut feeling is probably yes. Again, don't quote me on that. That's not legal advice. But I do see liquidated damages provisions. Yes.
Julie,
Is,
you can go ahead and take a couple more questions before we wrap up.
okay, great.
So I want to make sure, I know that there was one more, but you can take at least a couple more.
Perfect. Thank you.
Mhm.
Is sharing lab fee an industry standard? Yes. I mean, I'm not going to probably not a standard, I guess, because I don't always see it, but it's certainly common to see. I see situations where the employer may have a lab that they have negotiated a fee structure with, and hey, if you use this, you don't have to pay, but if you want to use another lab, then there is going to be a fee share or something like that. Um, again, you want to understand what that is. You want to make sure that the contract outlines what that's going to look like. But I would say, generally speaking, it is not unusual to see a lab share or a share of the lab fee. Um, so a couple of questions, well, 3 questions, I guess, here. In 2 interviews, I was asked why many dentists are placing such a strong emphasis on continuing education. Should I consider that a red flag? Um, Probably not. But I do think it's an interesting question. And I say this as, as an attorney, I think sometimes there is within certain professions, and I would again put mine there. I think there's kind of a difference with the old guard and the new guard, like, why do y'all want all of that? I think that it might just kind of be that type of attitude. I don't know that I would necessarily say it's a red flag. Now, if they're saying like, no, you can't have any time off for that, or we're not going to let you do that, then yeah, that may be. But the comment, I don't know. Um, is it a red flag if a practice limits continuing education to only what is offered through their DSO? I would say if they are telling you you can't attend or participate in anything else, yes. If they're telling you we're only going to pay for that, probably not. Um, reasonable stipend for continuing education and an associate contract. Um, I'm always happy to see 3,000. 2,000 is okay. I think getting any contribution there is certainly good. But I would say in the range of 2 to 3 is probably minimum for me.
And we'll go ahead. There's a text question for you again.
Uh,
So go ahead. That will be the last one. And can we go, because there'll be opportunities, please take down Jillian's email address so you can ask additional questions, as she said. But we also have a QR code that you'll be able to scan. I think you have one more slide after.
Yes, there you go.
And so that will help you also get information about Panacea's contract review. So I want to make sure that everyone has that. As the members, there is a discount that is offered. So I just want to make sure that we get that up there. But go ahead, Jillian, the last question, please.
Sure. The last question is withholding federal, Social Security, Medicare, state taxes payable to employees and industry standard? How can we negotiate that? So I think the difference there is going to be, uh, are you in an employed position or are you an independent contractor? If you are employed, then those things are going to be withheld. If you are an independent contractor, they will not be. Um, I don't know of a way to negotiate that because that is more of a legal classification than it is. Now, I mean, if those amounts are going to be set, essentially, is what I'm saying. Those are not going to be things that typically the employer has a lot of control over. So, and again, there may be some of these that I'm not getting the context of it. So again, feel free to reach out if you're like, I don't think you got what I was saying. But if I'm reading this right, then withholding those things for an employee is absolutely standard. And I don't know of a way to alter that.
Jillian, I want to thank you for a really robust conversation tonight. Lot of questions. And I want to thank all of you for participating in tonight's webinar and Panacea Financial and Legal for sponsoring it. For more information about Panacea's contract review, you have the QR code there on the screen. Please scan it. Again, as an ASDA member, you do receive a discount. And Julian will be more than happy to answer just questions that you have and give clarity to some of those that she's already answered. And if you'd like to view this webinar again, I know several of you have asked that. It will be posted in 1 week to ASDA's YouTube channel, and then it'll also be saved on our webinar directory at asdanet.org. And we'll send you a reminder when the webinar is available on the website. Again, thank you all for hanging in there. Thank you for the good discussion. And thank you, Jillian, for your support.
Thank you.
Have a good night, everyone. Rimsha, if you can hang in there.